As a periodontist, I really don't like to see that people losing their teeth. However, if we get to the point that the tooth is not really savable because of gum disease or periodontal disease or because of the caries or fracture, then eventually it has to come out. When patients lose one tooth, we are thinking about how we are able to replace it. In order to replace a missing tooth, the goal is preserving what we have, both in terms of the soft tissue or the bone, because if we lose it, it's much harder to reconstruct everything, and sometimes it's not predictable or sometimes it's not possible. So what we do is at the time of extraction, we extract the tooth very automatically. That means we try to preserve the bone and gum together, because we need both of them for future implant placement. So the goal of the procedure, we call it as socket preservation or socket grafting. Means when we extract the tooth, we put the bone grafting at the same time, because if we lose the tooth and we don't preserve the bone in that area, the bone structure is going to be lost quickly. We usually cover that bone graft with a layer of the collagen membrane to make sure we stabilize the bone graft in that area, and we cover the area with patient-owned gum. We try to give the patient some temporary replacement in order to make sure patient is comfortable to go into their social life or private life. And then by the time that healing period is over, then that area is going to be ready for implant placement or anything that is called for the replacement of missing tooth. Hopefully you're not losing your teeth, but if it comes to the point that you have to extract one of your teeth, you can always call us before you extract your tooth, and we can do the complete exam. We can take CT scan, we give you all information you need, and then we do the procedure with a minimally invasive approach in a way that we can not only preserve what you have, we give you a better quality of the bone for future implant placement.